Hi everyone. Today let's see about the salient features and management of thyrotoxicosis. I'm Sasikala, assistant professor, belongs to Medical and Surgical Nursing Department. At the end of the teaching, the students will be able to define the term thyrotoxicosis, differentiate hyperthyroidism and thyrotoxicosis, identify the signs and symptoms of thyrotoxicosis, discuss the management of thyrotoxicosis, and explain about the nurse's role in treating clients with thyrotoxicosis. To begin with, let's know about what is thyrotoxicosis. Thyrotoxicosis is potentially fatal acute episode of thyroid overactivity which require immediate medical attention. When we study about thyrotoxicosis, many used to have a query whether this hyperthyroidism and thyrotoxicosis are the same. Actually, hyperthyroidism happens specifically when our thyroid gland both produces and releases excess hormone. It is otherwise called overactive thyroid. But thyrotoxicosis happens when you have too much thyroid hormone in our body in general. For example, too much of thyroid hormone from taking too much of thyroid medication, or any infection to the thyroid gland which does not allow the released thyroid hormone to involve in metabolism. So it is not same but looks similar. Signs and symptoms of thyrotoxicosis are: first one, experiencing unexplained weight loss and irregular heartbeat or arrhythmias. Many times people complains about tachycardia, that is increased heart rate, and experiencing much muscle weakness. People will have tremors and shaky hands, feeling of nervous and very anxious, and experiencing increased sensitivity to heat. And sometimes female may have irregular menstruation. These are all the salient features of thyrotoxicosis. In thyrotoxicosis, we can identify some typical signs related with the eyes. First one is Dalrymple sign. When a person looks straight forward, we can identify the rim of the sclera is seen around the cornea. So that is called the Dalrymple sign. And second one is Geoffroy's sign. So in this sign, when a patient looks upward, there will be absence of wrinkling over the forehead. That is Geoffroy's sign. Third one is Von Graefer's sign. In this sign, when a person looks straight, the lagging of the upper eyelid can be seen without moving the head of the patient. That is called Von Graefer's sign. Fourth one is Stillwax sign. Here, staring look with infrequent blinking we can identify. So these are all some typical eye signs in thyrotoxicosis condition. As we have seen in the definition of thyrotoxicosis, we have seen that it requires, it demands medical attentions immediately. So we must know to treat the patients with thyrotoxicosis. So there are three main categories through which we can treat the patient. First one is medical therapy, then radio iodine ablation, and third one is the surgical management. Let's see one by one in the next slide. In medical therapy, first drug of choice is antithyroid drugs like carbimazole, methimazole, and propylthiouracil. So in these drugs, all these drugs belongs to thiourase group, which blocks the conversion of T3 or T4 in the peripheral tissues. Usually this propylthiouracil 100 milligram will be prescribed for 4 to 8 weeks. At the end of the 4 to 8 weeks of this therapy, usually patients will become euthyroid. That is, their thyroid level become normal. And second drug of choice is iodides. Iodides, it is the fastest acting thyroid inhibitor. It reduces the iodide transport, oxidation, and organifications, and to block the release of T3 and T4 hormones from the thyroid glands. And third one is beta blockers. Usually these beta blockers are given. Usually these patients used to have tachycardia, increased cardiac rate, to stabilize or to reduce that condition. Beta blockers like propranolol, atenolol can be given for the patient. The second choice of treatment for thyrotoxicosis is radioiodine therapy. And this radioiodine therapy is very simple and economical therapy. Usually, the dosage what they use is 5,000 to 8,000 rats. So before we start this therapy, the patient must be euthyroid. That means the patient's T3 and T4 level must be brought to the normal level in order to avoid the thyroid storm. That's one of the complications of this radioiodine therapy. For whom this radioiodine therapy is indicated means it is indicated to the patients who is above 40 years and usually who have got failed to respond the antithyroid drugs and failure of surgery. And who is contraindicated? It is contraindicated during pregnancy and lactation, and in the case of the severe thyrotoxicosis status with other malignant thyroid conditions. This is about this radioiodine therapy. The third choice of treatment for thyrotoxicosis is surgical management. The main objectives of this surgical management is mainly they will do thyroidectomy. It can be of subtotal thyroidectomy and total thyroidectomy. Usually they will go for subtotal or total thyroidectomy. What is the objectives of this surgical management is in order to have a complete and permanent control of thyrotoxicosis. That is the main objective. Before we do this surgery, the patient has to take his or her antithyroid hormones or antithyroid drugs up to the day of the surgery. Because for this treatment also, the T3, T4 level must be in the normal. That is, the patient must be in euthyroid state. And the next point is about the surgical management is usually they will go for subtotal thyroidectomy. While doing the surgery, they'll be leaving around 4 to 8 grams of residual thyroid tissues in that site during the subtotal thyroidectomy. When they will go for total thyroidectomy means they will consider this total thyroidectomy if the patient is infertile or Graves' disease with some coexisting eye diseases, means they will suggest for or consider for total thyroidectomy. Now we'll see about the nurse's role in managing a patient with thyrotoxicosis. As we know, it is a medical emergency condition. Nurse's role in identifying, monitoring, and treating the patient is very, very essential. The nurse has to initiate immediately certain measures when she receives patients with signs and symptoms with thyrotoxicosis. Usually, we know the signs and symptoms like patients comes with dysarrhythmias and tachycardia. In some patients, we can see signs of dehydration. So, placing the patient under the cardiac monitoring, if required, intubation, putting the patient under mechanical ventilation with the supplement of oxygen is very essential. Supportive managements like IV fluids, antithyroid medications, IV corticosteroids, and beta adrenergic medications to be administered as early as possible as per the physician order. So the nurse must be very astute in his work, and she should able to identify the signs, and she should be able to initiate the care is Very, very important. The second main important role of a nurse in this condition is education, nursing education. So when we identify patients with hyperthyroidism, so we know after a certain period if the condition is not under control or some kind of patient is in a thyroid supplementation or any kind of an infection, patient may get into the trouble like thyrotoxicosis. So we have to teach the patient to adhere on thyroid drugs, okay, thyroid related. If the patient is on hyperthyroidism treatment or in an or some supplementation with the thyroid medication, we have to tell them to adhere on medication. That is very important. And we have to teach them how to identify the signs of increased thyroid hormone. So signs like palpitation, so arrhythmias, dehydrations, sudden weight loss, anxiety. So these are all not the normal sign. So we have to teach them these are all the signs of increased thyroid hormone. So whenever they encounters with this kind of signs and symptoms, they have to consult their physician. That information, that awareness, we nurses has to give to the public. And we have to tell them when to seek medical help. So where to go, which consultant to go. Okay, so those details also we have to give to the patients. So imparting all these information to a client is very essential. That is a very essential role of a nurse also. Dear students, I believe you are very clear about the nurse's role in caring a patient with thyrotoxicosis. Dear students, hope you have got some information and some salient features about thyrotoxicosis, and you come to know about what is thyrotoxicosis and how to identify the signs and symptoms of patients with thyrotoxicosis, and to the treatments like medical management, radioiodine therapy and surgical management, and the role of a nurses also we have discussed. Hope you are clear with this content. Thank you for listening. Thank you.